Yeah, so tongue sucking is primarily because of the nervous system dysregulation. So what we are doing is that the palate on the top, which is basically the roof of the mouth, we have two bones that come together, which is the palatine bones. Just one second, could you give me that the side view? Yeah, this one. Let me just show it to you. I don't know if it's visible, but I'm just going to make sure that it's. Sneha, let me know if it's visible for you, my dear. Okay, so this is now what you're seeing is basically an air. So you can see that this is the palate. The roof of the mouth is called the palate, and this has two bones in it, two palatine bones that come together. Okay, now what happens in a child who is thumb sucking is that behind this we are actually having a lot of structures internally, and you can see this is the palate. All right, so this one, what's happening with this is that when the children we do a lot of regulation because of the tongue. The tongue sits right, the resting portion of the tongue is right behind the front teeth. That's where it's supposed to be, like this. So when you're in a resting position, for all of us, starting from infancy onwards, your tongue tip is supposed to always be touching the back portion of the tongue, the front two teeth. That's the resting position of the tongue. Now, often when we do not have the experience of or a dysfunctional breastfeeding, or the fact that the baby couldn't feed and we had to put them on the bottle or given a dummy, for example, for sucking babies. So using anything else besides mother's breast or a dysfunctional breastfeeding itself can cause the tongue to have a low lying position, which means it's not on top anymore, it's lying low. Okay, so then what happens is you don't get that contact here at the back here to give that circulation in the body. The nervous system regulation happens with the contact of the tongue on the palate. There's a connection to the brain. That's what happens. Now, if I don't have that, then what I will do is I will use my thumb to go inside my mouth and make a contact here. This is what a child does. So they're sucking on their thumb, which means they're trying to get a emotional regulation to happen. And because it's related with the emotions, what you're doing is you are able to address it using flower remedies.